Hi, I'm Dr. Poray, a sports and family chiropractor in Brooklyn, Ontario. I recently had a patient come in to see me with a shoulder injury, which turned out to be a rotator cuff strain. Now, she was puzzled because she thought that this was something that only happened to athletes. Although she's very fit and very active, her injury was the result of a fall while holding onto a banister. Now, the rotator cuff is actually not one muscle, but four, which surround the shoulder joint. It's comprised of the supraspinatus and the subscapularis, which are internal rotators, and the infraspinatus and teres, which are external rotators. It is also the job of the rotator cuff to hold the humerus, or the upper part of the arm, into the joint while other forces are trying to pull it out. This is most often seen in throwing actions, like pitchers, or the crawl or the butterfly stroke in swimming. Now, injuries to this structure can occur either by overuse or by sudden trauma, as in this particular patient. Now, with swimmers, pitchers, volleyball players, football quarterbacks, or other throwing athletes, multiple repetitions or muscle contractions can result in excessive stress, leading to a breakdown in the muscle or the tendon fibers. That excessive stress presents as pain in the shoulder, and it's usually the internal rotators, or the supraspinatus or the subscapularis, which are involved. But trauma, like a sudden stretch while the arm is in a vulnerable position, can also tear one or more of the muscles in the cuff. It will depend on the position the arm was in and the direction of the force, which muscle is ultimately affected. Now, once you've established which part of the rotator cuff has been injured and the mechanism, you can start the treatment. The first thing that must be done is to cease the activities that are responsible for the injury. For an athlete, this is a hard pill to swallow, but without rest, the body cannot repair itself. The rest time will vary depending on the extent of the injury, but generally 4 to 6 weeks is about average. Next, some sort of active therapy is necessary to speed up the healing. So in the initial stages, the application of ice to the injury is a good start. Apply the ice, which can be in the form of ice bags, gel packs, or ice cups, over the injury site for 15 to 20 minutes at a time, once per hour. I personally like ice cups because the ice moving, because when the ice is moving there is less chance of frost damage to the tissues, and the motion creates a massaging action. Now, you can make an ice cup fairly easily by freezing a styrofoam cup of water in the freezer. Then, to use it, simply strip down a little of the styrofoam to reveal the ice at the top, kind of like an ice cream cone. After the application, stick the ice cup back in the freezer until the next application. Cheap and effective. Some people have asked me if using cold rub-on gels works. Well, these rub-on gels may be helpful for controlling pain, but they're somewhat ineffective on inflammation. Other methods of controlling inflammation may include natural products like arnica, cayenne, or bromelain, or you can use anti-inflammatory medications like NSAIDs and cortisone injections. You should ask your naturopath about the natural products, or your family doctor about the NSAIDs and cortisone. Therapies that are also helpful include acupuncture, cold lasers, kinesiotape, and microcurrent. After a few days, you can also introduce ultrasound, massage, or myofascial therapy. As a chiropractor, I will use many of these therapies, but I also have concern about the biomechanics that have led to an overuse injury. First, I need to investigate the nerve origins to the involved muscles. If the nerve supplying the muscle is compromised, then it may cause ineffectual contractions, which can eventually lead to bad techniques. Next, I will make certain that the shoulder joint itself is capable of proper motions, and if it's not, then I'll apply techniques to change that. As the injury heals, it then becomes necessary to add graduated exercises to improve the range of motion and strength. At the appropriate time, the athlete can gradually return to activity. At this point, it would be a good idea to examine the techniques and try to correct them to avoid a recurrence. This is also a good time to apply kinesiotaping, which can be used to augment and stimulate certain muscles and to help stabilize an unstable joint. With respect to K-tape, find out if your therapist or your doctor is trained in the use of kinesiotape, since improper techniques or applications may have negative effects. If left unattended, rotator cuff injuries and their causes may lead to conditions which require surgical intervention, premature endings of promising sports careers, or even lifelong discomfort. Well, that's all for today. Thanks for your attention. I'd like to, if you would like to contact me regarding these or other health issues or injuries, you can contact me at the Brooklyn Family Health Center on Brock Road between Brooklyn and Whitby by calling 905-655-5767. And I also invite you to look over my website at www.drporay.com. Thanks very much.